My presentation will deal with the management of this kind of extremely rare tumors, because the incidence of this tumor is about 0.5/1 per million per year. So it is considered as an ultra rare kind of tumor. So the issue is that how to manage these ultra rare tumors, and it's not easy because due to the rarity of this kind of diseases. So the first part of my presentation deal with the management, the staging of this kind of tumors, while the second part of the presentation is regarding the treatment, which depends on the staging of the disease. And importantly, the right treatment allows a 5-year survival of more than 70%, which is a great number, and means also that a part of this kind of patients may be cured by the right treatment. So it is very important for the community to know the best way to stage this kind of patient and to treat this kind of patients. And the last part of my presentation are the future perspectives. So what are the new treatments, what are the new hopes, and what are the new clinical trials for this kind of patients? This is the overview of my presentation. The mainstay, of course, is surgery that allows us to be more precise in definition of this kind of disease. As far as the surgical excision is important, radiotherapy is the second point of the treatment of this kind of tumors. And it is crucial that both surgery and radiotherapy will be performed in high expertise centers, because it is very different if you perform this kind of treatments in a center without experience or with experience. The treatment of radiation is for the posterior cranial fossa, but also for the spine and the brain. And after radiotherapy, it is suggested to do chemotherapy, both for intermediate risk, but also for high-risk patients, because we know that even in patients with intermediate risk, the risk of relapse is not so low, so chemotherapy improves in a significant manner the survival outcome of these patients. Regarding potential new treatments, we know that, especially in adults, the vast majority of these patients may harbor a sonic HH alteration of the disease. And so we now have a drug that hits this kind of alteration and may be used in the clinical treatment of these patients. More importantly, this approach has been included in the early phase of an EORTC trial that is started now across European centers, but also outside Europe in many centers of the world.